before, before we really get into kind of the ins and outs of what the Affordable Care Act is and all the details, I think it's really critical to understand what's called the Iron Triangle, and it really is we call it the Iron Triangle of healthcare, and it's really a foundation for healthcare, healthcare policy, and even all policy, all public policy in general. Um, and so, what we try to talk about, or what the Iron Triangle refers to, is this concept that there are these three competing issues: cost, quality, and access. And I think most people would agree with this statement that any politician or anyone who tells you that they can reduce the cost, increase access, and increase quality all at the same time with one single policy, um, you know, is probably lying to you, or they just don't really fully understand, the issues at hand. Um, it's generally believed that you can, excuse me, really address two of these issues. You can usually address quality and access, but that it will come at the expense of cost. Or you can address, um, address cost and access, but it may come at the expense of quality, and so forth. And, I think the majority of people believe that, there were different competing issues within the Affordable Care Act, and everyone wanted to address, have different parts of the Affordable Care Act that really addressed all three of these. But the basis of the Affordable Care Act was really about access. It was, we had a really large uninsured population in this country, and people saw that as an issue. And so if you think about the Affordable Care Act, yes, we have, been able to increase access, but that comes at an extreme cost. And, we don't really know. I would say it's probably a little too early to understand, what increasing access does to the quality. You think there's some early studies that have come out in JAMA that have looked, that have compared, patient outcome, or, outcomes of states that expanded Medicaid versus ones that didn't, and found that quality of, healthcare quality outcomes actually have increased. But I think, again, it's a little early to overall say that, we were increasing the quality with the Affordable Care Act. But, at the basis of every policy decision and every, every part of a policy is really, what part of this triangle are you focusing on, and or even what two parts of this triangle are you focusing on, and really what does that mean for the third part, and are we as a country willing to swallow that pill for the sake of improving the other parts. And you could argue that, currently in our country, there are some very good quality outcomes. We have very, very good quality outcomes for many illnesses. A lot of the cancers, we have phenomenal outcomes compared to other countries. You could even argue that, if you have the money, you can get access, but overall we have an access issue in this country. When you compare us to other countries that are at the same economic level of us. And so, we as a country, I think everyone saw that as an issue before the Affordable Care Act started, and wanted to address it. But I want to note this slide. I think, this would be a perfect example of a short answer question on an exam. I think, again, it's absolutely critical that you understand that. So we'll just keep going forward. Just to back up, problem one, what's driving health reform? large uninsured population. So I think you want to pay attention specifically to the next set of slides about what is driving healthcare reform. This is a good question to be on exam. To be on an exam is what drove our healthcare reform. First is the uninsured. So we were exceeding before 2010, exceeding 47 million people without health insurance. It's a lot, and that is gonna, causing a major issue on our little emergency rooms down here, and hospitals, aren't able to cover it, and it's driving up the rest of the cost. Problem two, overall we're spending too much. We're there is drastic price variation without any explanation. And there's little idea about cost and quality as it relates to other, potential treatments in the market. We have an issue with a lack of portability with our insurance. So what it means is that we're in a country where where most people below the age of 65 get insurance through their employer. And so what this means is that when you switch employers, which is actually very common in today's day and age, a lot less common than it was 30 years ago, you lose health insurance. And by having it linked to your employment, it means that many people, they stay in a job that maybe because they fear they're going to lose coverage, maybe they have a pre-existing condition. If they leave their current job and they try to get insured through another insurance company, they're worried they won't be able to because they don't have to, they can deny them due to a pre-existing condition. So there's lack of portability, and in general there's an agreement that is not good in general for the growth of this country and our GDP and our ability to remain competitive in the global marketplace. Next, there's a huge lack of transparency. So people really, and this goes back to Crossing the Quality Chasm, that report and the other Institute of Medicine reports, but there is very little coordination behind patients' health histories, and it makes it difficult for people to switch providers. It makes it difficult when people want to, try to be better consumers of healthcare and go to cheaper places, or maybe perhaps their insurance company has changed who's in network and who's out of network. The lack of transparency in a unified medical record system, or even just a system to ensure that all of the providers along the healthcare continuum are able to view records, causes a big problem with overutilization of care. It also causes medical errors, and so forth.